Hi, my name is Dr. Anthony Lemaire. I'm a cardiothoracic surgeon. Today we're going to talk about managing patients who have infection of their heart valves. Now, infection of your heart valves is often referred to as infective endocarditis, or sometimes patients or people just say endocarditis. And so for the purpose of our discussion today, I'm going to refer to as infection of the heart valves as endocarditis. Now, what exactly is endocarditis? Endocarditis, by definition, is inflammation of the lining of the heart valves. Now, how do you get inflammation in the lining of the heart valves? That's classically caused by bacteria in the blood that then goes into the heart valves and the lining of the heart valves and leads to inflammation. And if the bacteria continue to grow, that inflammation can get more impressive, more complex. That can lead to growth of the bacteria, leading to what's referred to as vegetations or foreign objects on the valve. It can also lead to the destruction of the valve. So the valve's unfortunately not working well. And if the valve's not working well, that can ultimately lead to heart failure. Now, before we go over how to manage patients who have endocarditis, let's actually talk about how common it is. It's actually pretty rare. Endocarditis occurs in 47,000 patients a year. And if you think of the entire patient population, that's actually pretty small. Oftentimes, these patients will present with signs or symptoms that are consistent with fever, night sweats, chills. They'll often feel fatigued, lethargic. Now, as I mentioned before, if the infection on the heart valve becomes complex and you start growing bacteria on it, sometimes that bacteria in the form of vegetations or foreign objects can break off. And if it breaks off, it can go to the brain and cause stroke symptoms. It can go to the extremities and cause pain. It can go to your spleen, your intestines, your liver. All these things can be caused by endocarditis. And based on where it goes, that'll actually that'll determine your symptoms and also how to manage it. Now, how do you diagnose it? Endocarditis is classically diagnosed by something referred to as the Duke criteria or Duke classification. And it's pretty complex. There's a major criteria, minor criteria with different testing. I'm not going to go over today the Duke classification. I'm going to refer you to that in the literature if you're interested. But what I will say is there are tests that are commonly done. Number one, blood cultures. As I said before, endocarditis, or inflammation on the heart lining of the valve, is actually caused by bacteria in the blood from all sources, as I mentioned previously, the mouth, the extremities, skin. Wherever the bacteria goes, it gets into the bloodstream, and that can go to your heart valves. So what you'll want to do is get blood cultures, take a sample of blood, and test it to see if there's bacteria there. That's a critical test. Another thing you'll do is just blood work, looking for your white blood cell count. A very common finding of patients who have endocarditis is an elevated white blood cell count, which is often a sign of infection or inflammation. Another test, which I would consider the gold standard test, is an ultrasound of the heart, specifically looking at the heart valves to tell you if there's infection. Now, an ultrasound of the heart is classically referred to as an echocardiogram, and there is a transthoracic echocardiogram, which basically means you take a heart probe, an ultrasound, and just put it on the chest, looking at the heart valves. There's also a transesophageal echocardiogram, where you're taking an ultrasound probe, putting it in someone's mouth, into their esophagus, and you're getting good images of the heart valves. Whichever test you get, what you're specifically looking for is evidence of infection of the heart valves, and if the valve is functioning well. If the valve is not functioning well, that actually can be a reason to actually have surgery. Or if there's a big vegetation on the heart valve, which you're afraid that might come off and go to the brain or anywhere else, that's another potential indication for treating the patient with surgery. So let's talk about it. How do you actually treat these patients who have endocarditis? Well, the classic treatment is antibiotics. Someone who has bacteria in the blood that's affecting the heart valves needs to be on antibiotics. And you'll generally do antibiotics that are specifically targeted to that particular bug, and that's why blood cultures are so important. These patients are often treated for about 6 weeks. After about 6 weeks, they're taken off, and their blood is tested to make sure this bacteria is gone. Now, sometimes people have such infections are so complex, it actually lasts longer than 6 weeks, but 6 weeks is usually the common amount of time. Another treatment is surgery. Now, surgery is classically used as a treatment option only if, for example, the valve is destroyed. If the valve is destroyed and the valve is not functioning well, that can lead to heart failure, and that be a reason to replace the valve. Or as I mentioned before, if the vegetation or the foreign object on the valve is very large, classically we consider anything over 1 centimeter to be large. If it's above 1 centimeter and you're concerned it might go to the brain, then that'd be another reason to consider surgery. All this obviously has to be discussed with the patient to make sure they agree with what you're saying. Now, before I actually go over the actual procedure, I just want to go over the anatomy of the heart here. This is a model of the heart here, and I just want to review it. So this is, I like to think of the heart in terms of size. This is the right side, right atrium, right ventricle, and this is the left side, left atrium, left ventricle. Now, blood will classically go from the right atrium to the right ventricle, and the blood will actually go through this valve, referred to as a tricuspid valve. And when the valve opens, blood will go through, and when the valve closes, blood will stay in each area. When this valve becomes infected, if it doesn't open well or close well, that can lead to heart failure symptoms. Now, by the way, this is the most commonly infected valve for patients who are IV drug users who ultimately get infection of their heart valve. As you know, patients who are IV drug users, sometimes their needles are infected, and that can lead to endocarditis. Another common valve that becomes infected is the mitral valve. The mitral valve is between the left atrium and left ventricle. And once again, if that valve is not functioning well, that can lead to the valve not opening well or closing, which can lead to heart failure symptoms. Another common valve that gets infected is the aortic valve, and that's between the left ventricle and the aorta. And that valve being infected, unfortunately, can cause heart failure symptoms as well. So I've on multiple videos reviewed how to replace valves, and so I'm not going to go into great detail on how to replace valves, but essentially the patient will go to the operating room, they go to sleep, their chest will be opened to either an entire sternotomy or a smaller incision through the sides, and the valve ultimately will be replaced. Now, there are certain situations where you can just repair the valve and clean up the infection, but most commonly you're entirely removing the valve and putting a whole new valve in. And the valve options are a prosthetic valve, either made from a cow or a pig. And the benefit of that is it lasts somewhere between 10 or 15 years and you don't require any medications. Or you can do a mechanical valve, which should last you hopefully for the rest of your life, but that will require blood thinners. The only negative of blood thinners, unfortunately, is that, number one, you will have to adjust your lifestyle. If you get into a car accident or fall or trip, that can lead to easily bruising or bleeding. And also, you need to get your blood checked and tested to make sure your blood levels are appropriate. So there are pluses and benefits to each particular valve, whether a prosthetic valve or mechanical valve. Okay, so once again, this is a brief review of how to manage patients who have infection of the heart valve. As I mentioned before, it's pretty rare to get this, but if you do get it, most people are diagnosed with blood tests, specifically blood cultures, looking at white blood cell count, an ultrasound of the heart, referred to as an echocardiogram, a physical exam findings. Sometimes people can have heart murmurs, they can have skin rashes, they can also have findings like their toes or fingertips being bruised or swollen because of the embolization to those areas or part of the vegetation going to those areas. Whatever way you're diagnosed with endocarditis, the most common treatment is antibiotics. That's medical management, classically 6 weeks, and after that, if the patient has heart valve issues where unfortunately the valve is not functioning well and it's leading to symptoms or there's a risk of stroke, that patient will be referred to a heart surgeon who oftentimes will replace the valve. Okay, once again, a brief description. If you have any questions or comments, please let me know. Thank you very much.